The cardiovascular system's complexities are fundamental to maintaining life, supporting both the structural integrity and functional capacity necessary for effective circulation of blood throughout the body. This narrative explicates the integral components, hemodynamic principles, and potential disorders affecting the cardiovascular mechanism, offering a detailed discourse on its comprehensive anatomy and physiology. The heart, an omnipresent organ, serves as the principal pump, facilitating blood circulation through the arterial and venous systems. The arterial system, composed of arteries and arterioles, carries oxygen-rich blood to various tissues. Conversely, the venous system, consisting of venules and veins, acts as a reservoir, returning deoxygenated blood back to the heart. Capillaries, the smallest and thinnest vessels, are pivotal as exchange sites for gases, nutrients, and waste between blood and tissues. Hemodynamics, the study of blood movement, underscores the relationship between pressure, flow, and resistance vital for circulatory function. The system operates optimally with sufficient volume and pressure, ensuring blood is adequately delivered to body tissues. Blood flow is influenced by pressure differences and vascular resistance, collectively referred to as peripheral vascular resistance. The velocity of blood flow is affected by vessel length, pressure gradient, radius, viscosity, and wall tension, maintaining a primarily laminar nature under normal conditions. Cardiac output, the heart's blood pumping efficacy per minute, depends on the stroke volume and heart rate. Varying with body size and metabolic demands, it has a wide range, notably enhanced during physical exertion. Preload and afterload are critical factors influencing cardiac work. Preload refers to the blood volume before contraction, while afterload represents the pressure faced during blood ejection. The pericardium, myocardium, and endocardium collectively constitute the heart wall, each layer serving protective, muscular, and membranous roles, respectively. Their collective contributions enable the heart's sophisticated contractile function and disease resistance. Cardiac function anomalies encompass diverse conditions like dysrhythmias, pericardial diseases, myocardial and endocardial disorders, congenital defects, and valvular dysfunctions. Dysrhythmias, characterized by abnormal rhythm, are classified into supraventricular and ventricular types and can vary from rapid to extremely slow heart rates. Disruptions in heart signal conduction, like heart blocks, severely impact circulation, while ectopic pacemakers precipitate serious arrhythmias. Disorders like pericardial effusion and cardiac tamponade pose significant risks by compressing cardiac structures, impacting blood flow. Myocarditis and cardiomyopathies typify myocardial diseases, with inflammation or congenital factors resulting in impaired muscular function. Infective endocarditis, while uncommon, poses a life-threatening risk due to infection of the heart's inner lining. Congenital heart diseases, stemming from anatomical anomalies, disrupt hemodynamic balance and can severely impair oxygenation. Valvular heart diseases impact blood flow directionality, potentially causing stenotic obstructions or regurgitant leaks, and are often detectable through auscultatory methods. Chronic conditions like hypertension and heart failure exhibit profound impacts. Hypertension increases cardiovascular strain, leading to ventricular hypertrophy and potentially heart failure. Heart failure disrupts the delicate balance between right and left heart outputs, often presenting as congestive heart failure with peripheral edema and pulmonary congestion. Circulatory shock represents an acute failure in perfusion, resulting from fluid loss, vascular expansion, or obstructions that manifests in systemic attempts to preserve life through autonomic responses and fluid redistributions. A deep comprehension of these mechanisms, from normal function to dysfunction, underscores the vast and critical intricacies of the cardiovascular and circulatory systems, emphasizing the paramount importance of this network to physiological homeostasis and survival.